So the study is basically for the new Defocus glasses for high myopia control. As everybody knows, it's a pandemic now, and India is also leading in number of patients. Of course, there are disparity in urban and rural population, but according to this paper, 50% of world's population is going to be myopic. So by 2050. So being in the eye care profession, it is our duty to take care of that. As you know, the comorbidities of myopia is cataract, glaucoma, macular myopathy, and retinal detachment, which can be a social burden on the society if your vision is not working properly. Most of the time, as soon as you diagnose myopia, you put a single vision glass and that's it. But what it does is it creates a hyperopic defocus at the peripheral retina, and that sends signal to the brain to keep on increasing the axial length. So what you need is a myopic defocus at the peripheral retina, but at the same time the focusing at the fovea has to be normal. So you need some system where you have at least two focuses. According to this study, which changed the whole perspective of how the focusing happens and how the axial length triggers, Earl Smith made this research on animals, and it showed that the defocus can influence the shape of the eyeball. And this again validated with the studies of monkeys, where they put in same monkey one eye plus and another monkey set minus, and where they put minus, the axial length kept on increasing, whereas plus it remains lesser. So definitely the defocus theory works, and then you can use like a simple progressive addition lenses, bifocal lenses. Better is 360-degree, that is a central distance soft contact lenses, and of course orthokeratology works best. It started with bifocal lenses, executive bifocals, and now there are multiple specialty lenses available in the market. So they are working well, but this is recently got FDA approved in USA, which is a good sign. But again, they say about 62%, but in reality it's about 50% myopia control you get. This is another famous design where you have a defocus in the periphery, and that also claims about 60%. So this American company called Myokiddo, I tied up with them since I practice in US, and they created this simple glass where there is a central hole and plus 4.5 diopters. That creates a myopic defocus, but it looks cosmetically quite ugly, and patient won't wear it for a longer time. The Myokiddo defocus has an extra power limits. All these Stellest and Myosmart has up to -9 diopters available. In this you have to -20 diopters. So this design, what we aimed is to check what happens. So as you know, the children's, it's very difficult to get the follow-ups and everything. So we created this special design. Of course it was their design, but we asked them to get it for us. So there are three, I'll show you in the picture so you'll understand what is happening. So there are 3 mm lenslets with more than +6 diopters arranged in circular manner at about 12 millimeters. And we selected the high myopes basically because that was our aim. So it will create a defocus at the peripheral retina. And we selected about 10 children, which were, actually we had a lot of children, but we selected only for this paper, only people who have the data. So 7 to 12 years of age, and -6 to -9, and both parents myopic. This is how the lens looks like. There is a lenslets about 3 mm, and they are more than +6 diopters. All the other designs which are available in the market, they are cosmetically nice, but they usually don't have more than +1.75 diopters. So that's why it is not giving you that extra control. So what we measure is of course axial length, refraction stability, and vision of course. So 10 patients, -6.25 to -9 diopters. Baseline axial length was measured, and of course all are Indian patients. This is the details of those patients that we selected. We purposely selected less cylinder, not more than 3.5 cylinder. But some of the patient with high myop has shown extra large cylinders. This is the graph. These are how the lens looks. So in results, it showed almost 80% patients could be controlled with the axial length elongation of about 0.05 millimeters, which is amazing. Of course, we had these patients on atropine, 0.01% in the morning as well as in the night, because they fall into high risk category. We have a Chawan Muscati Jetani risk calculator where we actually find out how much this patient is going to progress further, and that's why we put all those patients, because they're already both parents myopic and -6. So basically it offers non-invasive and easy to use. It looks little cosmetically off, but yes, this is the cheapest option. Apart from, of course, you have to use the pharmaceutical agents also. You can have a combined therapy, as we have done in this case. And nowadays, of course, red light therapy is promising, and we can add that. These are the different things that you can add to control the myopia.
Yeah.
These are my references.
Okay,
Thank you so much. Questions?
Yeah, how did you measure the axial? You can just load and get started.
Yeah, I will master
It's
it.
already there, ma'am. I've already